On behalf of Dr. Anita Borges' family, we'd like to thank all of you for being here today as we celebrate and honor the life of an extraordinary woman. Dr. Anita Borges, or B, as we, her nieces and nephews, so affectionately called her, was truly one of a kind. Since her passing, we've been reading and receiving so many incredible messages and stories and tributes and newspaper articles that describe her as the queen of histopathology and the last word in oncopathology, a giant, a genius, a goddess, a legend, a pioneer, and a trailblazing icon. And to be honest, my first instinct was to pick up the phone and call her up and say, B, we knew you were famous and all, but not that famous. Like, it's a bit much. And I know how she would have responded too, with a, what rubbish, I tell you. Because that was who she was. She wore her greatness with grace and humility. And it didn't matter who you were or where you came from, whether you were a patient, a colleague, a student, family, or friend. She treated everyone with the same kindness and compassion, dignity, and respect. As Dr. Natarajan, her life partner, best friend, and companion of over 58 years, so beautifully put it, she was a stethoscope with a microscope, because she had the unique ability to see beyond what was right in front of her. A gentle yet firm giant who inspired, influenced, and left an indelible mark on the countless people whose lives she touched, so many of whom are here today. So I'd like to invite Dr. Mufaddal Muneem, a consultant histopathologist based at Charing Cross Hospital in London, who's come all the way from the UK to be with us today. He was one of Dr. Borges' best and most trusted students, and I request him to speak about his memories of Dr. Anita Borges.
Good morning. It's an honor and a privilege to be here today to address you at this event to celebrate the life of Dr. Anita Borges. I first encountered Dr. Borges before I knew who she was. So let me take you back 29 years. I was a fresh medical graduate who had come to visit Tata Memorial Hospital to fill out an application for postgraduate training. I was descending the central staircase in the old hospital, which wraps around a tiny little lift which the medical staff used to access various floors of the old hospital. And as one descends down this staircase, it gives a brilliant view into the lobby of the hospital, the portico beyond the open doors, and the veranda where the driveway is. And as I descended, I saw a car pull out and a tall, fair lady in a sari step out and start ascending the steps to the hospital. And as she ascended, the watchman at the gate stood up and greeted her. She entered the lobby, the security guards straightened up, the receptionist smiled. She acknowledged all of them gracefully, and then she proceeded along the lobby. The lobby was packed. However, people seemed to make a path for her, and she reached this little lift. And as she reached the lift watchman stood up, and lo and behold, the lift doors opened. She stepped in, and she was gone. All of this happened in about a minute, and it left me wondering who this lady with the awesome presence was. When I finally joined the department, I found out this was Dr. Anita Maria Borges. I think it would be very reasonable to say that she was one of the finest minds to have graced pathology and even medicine in recent years. And that is a lucky thing for us, because I'm told that she originally wanted to do obstetrics and gynecology. So we in pathology are extremely grateful that she decided to take up pathology. She was a pan-cancer diagnostician extraordinaire, able to diagnose cancers of all types. And she had a slight advantage over there because she was there at the beginning of the cancer story. And so therefore, she could see how those stories developed or died. However, the rest of it was all due to natural talent, brilliance, and a deep understanding of her subject. She was able to look at tissue under the microscope and predict what else might be happening to the patient in distant organs, diseases that might occur subsequently. And these predictions of hers were not only uncanny, but sometimes verged on the miraculous. Now, most of these deductions, almost like a Sherlock Holmes with a microscope, were because of her deep understanding of medicine. However, some of the rationales were, how would you say, slightly more down to earth. I was sitting in the grossing room at Tata Memorial Hospital one day, evaluating a specimen of a radical vulvectomy, which had been done for a vulval cancer. And she came into the cut-up room, and she looked over my shoulder, looked at what I was doing for a couple of moments, looked at the specimen, and then said, "Ah, a Catholic lady." I was gobsmacked. So I looked at the name of the patient, and indeed there was a correlation, and then she breezed out. And I simply could not understand how she could look at a small part of the body which had been removed and not only try and predict the religion of the patient, but also what subsect of that religion that patient belonged to. So once I finished doing my work, I went down and looked at the hospital notes of the patient, and indeed she had been registered as a Catholic. So I went and hit the books to try and find out what it was that she had seen, which I was not aware of. You have to remember that we didn't have Google at that point in time. We couldn't put in, vulva and Christianity. So, and I got nowhere. It took me a lot of time to go through the textbooks. So I finally went back to her and asked her, "How did you know that patient was Catholic? You just looked at it and you said she was Catholic." She looked really amused. She smiled sheepishly at me and said, "Ah, Mufi, as I was coming up to the department that day, I bumped into the surgeon. He told me he had operated on her the whole day and it was a Catholic lady." La voila. The other thing about Dr. Borges was that she was always relevant. And she was always relevant in a rapidly evolving and rapidly changing medical landscape. And one of the reasons she was so relevant was because of the strong partnerships she forged with her surgical and oncology colleagues. And this allowed her a much better understanding of disease and an ability to provide information which was relevant irrespective of time. She's one of the few people who actually understood what they were talking about. Somebody who had the ability to communicate complex thought processes effectively, making the difficult and arcane seem effortlessly simple. And this clarity of thought has led to multiple publications and articles, and has culminated in her being the author or responsible editor of the 5th edition of the World Health Organization classification of tumors, which most of us use as a Bible in daily practice. She was a very hard worker. She approached her practice with complete integrity and commitment and worked very, very hard. She had a tireless attitude, boldly overcoming obstacles to continue her work on issues that mattered to her. Now, she was really, really dedicated, and she tried for years to get us to address her as Anita. But we'll come to more of that later. In terms of her impact, it would be no exaggeration to say that she, in the course of the 50 years of her career, she had diagnostic input into anywhere between 500,000 and 1 million patients, something that would take each of us several lifetimes to do. In terms of her impact as an educator, she had great success. Just consider this. In my department at Charing Cross Hospital in London, we have 5 pathologists who have been trained by her, 2 of whom she supervised their MD theses. Therefore, 10% of the workforce of a large central London hospital has been trained by Dr. Borges. Education was a passion, and she has been regarded as an exemplary teacher by generations of students. But she had a very, very different way of teaching. She didn't really teach me. She encouraged me to think, something that is invaluable and was sorely lacking from the Indian education system at that point and possibly even now. This unique ability in our situation of asking questions rather than providing answers to the student and stimulating the student to think about why something happens, how something happens, when something happens, allows them to move ahead on their own feet. Her idea of starting an online teaching program as a necessity of the COVID pandemic has turned out to be a brilliant success with the able support of Dr. Sumit Gujral. What started off as a bi-weekly evening online session to teach pathology postgraduates across India, inviting specialists to come and talk on a topic each evening where students could sit in the comfort of either their own departments or their own homes and learn, was fantastic. This eventually spread thanks to her contacts and influence, in the sense that she was able to invite experts on subjects and diseases from all over the world. So effectively, Indian students, even in remote locations, had access to the most novel ideas. This project now is subscribed by over 600 medical colleges in the Indian subcontinent. And you can see how popular it is. Sometimes there are up to 1,600 students attending each session. That is a dramatic impact. The practice of medicine is not a competition. So I do not refer to Dr. Borges as a champion in respect to the first definition on the screen. I refer to her as a champion of histopathology. It is well known that pathologists are not necessarily regarded in the same esteem as their surgical or medical colleagues. And Dr. Borges' viewpoint was that a good pathologist was worth their weight in gold, yes, even at today's rates, and was an equal, if not better partner to any medical relationship because of the crucial information pathologists could provide, which no other subspecialist could. Over her active career, she has instilled self-belief, confidence, and a recognition of self-worth into generations of histopathologists, thus improving the way the histopathology community looks at itself. Her viewpoint that histopathologists were not there simply to respond to the curiosity of other medical practitioners was best seen in her approach to frozen sections, where a frozen section was simply not done if the answer to it did not change intraoperative management. She was a compassionate human being who believed in doing the right thing. She either supported people in doing the right thing or through her own actions set an example for people to follow. As an individual, she was amazingly generous, not only for her time to her students, her patients, her colleagues, to members of staff, but also in sometimes providing financial assistance to members of staff who were in need. And I'm aware of several instances in which she has actively gone and paid for patients' treatments when they could not afford it. One of the things that has been constantly floated in the last week since her passing away is the fact that so many people remember that ma'am came to inaugurate their laboratories when they started their own practice. She took the time out from her busy schedule, went, inaugurated their practice, gave them her blessings, and then helped them subsequently to establish themselves, to set themselves up. I think most of us are aware that she had no patience with idiocy or foolishness of any kind. However, there was never any element of rancor or malice in her behavior to anybody. If I was going to sum it up in my words, I would say, all in all, she was a wonderful human being who, despite appearing formidable, had a very, very large heart. And for those of us who conquered our fears and approached her and interacted with her, the interaction left us richer in all aspects and significantly better than before. Another ability that Dr. Borges had was the ability to age gracefully. So the picture on the far left is courtesy Dr. Sanjay Pai. It's from 1992. The picture in the middle is from 2001, and you can see Dr. Borges there on the bottom left. And then there's that picture on the right from 2023, and if I may say so, she looks even lovelier in 2023. And not all of us have this ability to age so gracefully. Oops. You can see me there in the center in 2001. I had a huge amount of hair at that point in time. Before I conclude, two things. On behalf of Professor Kikeri Naresh, who's currently in Seattle, and my many colleagues in London, including Dr. Rati Ramakrishnan, Dr. Suchna Mukhopadhyay, Dr. Priya Bhagwat, Dr. Saral Desai, Dr. Loli Das Gupta, and Dr. Ashutosh Nerurkar, I would like to extend their sincere and heartfelt condolences to Dr. Natarajan, the Borges and Natarajan families. On behalf of all of us who have been blessed with the opportunity to interact with her, I can say without reservation that she will be missed. But we will cherish and treasure the memories that we have been left with. On a more personal note, where did my journey with Dr. Borges take me in the last 3 years? Sorry, 3 decades. She stopped just being a teacher and a mentor for me, and she became, over time, a mother and a friend. There was a silent delight in seeing how I developed and matured, an active interest in my family. She used to call my son that Gunda Arshad. And I think she enjoyed seeing the flowers bloom in my garden in London, perhaps reminding her of the happy times that she had spent there when she was younger. So, goodbye, ma'am. Rest in peace. It would have been very easy for me to address you as Anita, as you had wanted and tried so hard for all these years. But I always thought ma'am suited you better. Thank you for being there, and I, in particular, will miss you tremendously. Thank you.